And welcome to Around the Ozark Spotlight. Each week we uncover the stories behind people who live and work here in Southwest Missouri. Those individuals with entrepreneurial spirit who work to develop the lives of others or even put pen to paper to write books about stories and history of the Ozarks and its people. I'm Scott Meier. Today we're going to explore the world of medicine with Dr. Jim Blaine, who's best known here in the Ozarks as the founder of the onsite clinics at OTC for health and wellness for over 500 and some employees and their families. And Jim, welcome.
Oh, well, thanks, Scott.
I think when we first met, I called you Dr. James. Then you said, well, drop that. So it was Dr. Jim. And then you said, well, drop that. And now that you're semi-retired, I don't know that you'll ever retire. It's just Jim. So welcome to the program. It's interesting. Anytime I do my research on guests that I'm about to have, you're one of the rare ones, quite frankly, locally, that come up with an entire page of history. You've been pretty busy here in the Ozarks as a physician.
Yes, yeah, I have. Yeah, it's been a fun ride. I've enjoyed it. I still enjoy it, and you pointed out I'm not totally retired. I now sit in for the guy that's younger and smarter than me that used to sit in for me at my clinic, and so I'm still busy with the medical society and
among other things.
Among other things, yeah.
Now, I also learned that you were a Sooner. I did not know that either.
Yes, that's true. Yeah, I grew up in Grove, Oklahoma.
Where? What's that near?
Well, it's near Miami, Oklahoma, which probably doesn't help you too much, but northeastern Oklahoma.
Right. Oh, no, Miami's where that's where all the casinos are. Is in Miami, Oklahoma.
That's true. Yeah. Grand Lake. Yeah, it's on Grand Lake.
Okay, so you grew up there, and high school, college at Oklahoma. Where did you do your internship work?
Well, I did Oklahoma State pre-med, and then went to OU medical school, and then did my residency family practice in Oklahoma City with the University Hospital at OU and St. Anthony's.
Okay, and decided on Springfield. You had lots of other opportunities of places to move to.
Yeah. Well, first I went to Siloam Springs, Arkansas, for a couple of years, and then I ended up joining a classmate of mine at Cox in the emergency room, and did that for 7 years, and then another 6 or 7 years at St. John's when the trauma center moved over there. And then I went to Smithland Callaway Clinic. I got back to my family practice roots and joined Smithland and did that for 11 years.
Was medicine part of your family? Did you have parents involved in medicine?
Yeah, my mom was an RN, and she was in World War II, and she was an Army Air Force nurse, and yeah, so I think that probably was one possible incentive. My undergrad was in architectural engineering, but when I started looking into medicine, it looked interesting, and I tried it and liked it. So,
well, I guess you both are building something, right? In medicine, you build the good health, and in architecture, you build homes.
Yeah.
So you've lived in this area the better part of probably 50 some years in Springfield.
Well, since 77, yeah. So it's getting there, isn't it? Yeah.
Okay. Now, starting the thing at OTC, that's many doctors, I think, spend a long time just operating a practice and doing their thing. But for whatever reason, and I hope you'll share it with us, you decided you wanted to do more.
Well, yeah, my initial on-site clinic, I left Smithland and went back for a couple of years to the ER up at Bolivar. Just thought that would be interesting, and then one of my former ER nurses headed up the clinic over at Paul Mueller's, and they were going to start an on-site clinic, and wanted me to throw my hat in the ring, and I did and got it, and so. And then moved from there to City Utilities and started a clinic there, and then finally OTC, as you mentioned. But those on-site clinics are kind of neat. They prevent illness. But we don't do that too well in the United States. I don't know if you were watching the podcast by former Cox president Steve Edwards recently, and he addressed that topic. And if you look at the 11 industrialized nations, number one as far as outcomes are is the UK. Interestingly, number 11 is US. Even though we spend over twice as much as any other country on healthcare.
Sure.
And so generally speaking, we treat illnesses. We're not very good at preventing them. And so what family practice does is prevent. And so, for example, in the UK, they have twice as many primary care physicians. And so Harold Bench, our former health director, used to tell me all the time that prevention is not very sexy, but it works. And I think that that's absolutely true. And so that's how we sold it to these companies. And you mentioned OTC, and of course, I'm a big fan of Dr. Hal Higdon over there, and we visit all the time. And he'd hired someone named John Akers, who's with insurance, and unbeknownst to me, he did a cost benefit on our clinic. I guess it could have turned out badly, but it didn't. It turned out very well. And the
Well, that's
point
good
is,
news.
yeah,
Right.
well, it's a win-win. I remember when I was at Paul Mueller, there was a guy that used to be on our city council, a friend, Conrad Griggs, and he and Dan Manna, who was the president at the time over at Paul Mueller's, I think that Conrad was kind of pimping me, so he asks Dan is loud enough for me to hear or overhear. How's that clinic going over there? And he said, "Well, it's the most favored benefit of my employees, and it saves me money. There's not too many things I can say that about." So I think these on-site clinics are good. I loved them because I guess the boards were my bosses, but they were all my patients, so that was okay. Uh, but they left me alone, and I got to practice medicine in a great city that I love, and uh, the best definition I ever heard of stress is the perception of loss of control, and I had control of my clinic. People weren't telling me I had to see so many patients in such a time, uh, it's been good.
My guest today on Around the Ozark Spotlight is Dr. Jim Blaine. Jim, best known for starting an on-site clinic at OTC, but also, did you start the clinic at Paul Mueller as well?
Yes, I did, and at City Utilities, and then at Digital Monitoring Products, so-called DMP, at company that not a whole lot of people know a lot about, but they make most of the alarm systems for the banks in this country, for example. Very high end, very very impressive organization. They're out by in industrial part of the city, but very very impressive company. Rick Britton started that many years ago.
How difficult is it for a physician today in a community like a Springfield where you've got two competing major hospitals? I would guess each trying to gather in the talent similar to, I don't know, professional football or baseball, if they can, get a doctor on their squad, if you will, and probably contract them. How difficult is it for somebody to do what you did, which is go out on your own as opposed to align yourself with one or the other hospital?
Well, that's a good question, but I was fortunate in that I had quite a bit of interaction with both hospital systems. For example, I was at Cox Emergency Department for 7 years, another 7 years at then St. John's, now Mercy, and so and I was fortunate to be friends with the leadership there and didn't burn any bridges, and so it was pretty easy for me. Someone coming in that did not have those uh, connections or maybe maybe more difficult. They'd have a little bit more difficult, I would think. But I hadn't done it all. It was complete support, and currently we've had quite a bit of interaction with leaderships. David Argetta, who's of course president of Mercy, and and then Max Buto over at Cox. These are two young. I'm 75, so these are
Hmm.
very young guys,
Sure.
that are very impressive. They're very supportive of primary care and prevention and community health,
Hmm.
and they've financially supported the medical society, and more importantly, they've supported us publicly as well, and with their leadership, and so I think the future is very bright. I think those two guys have their hat on straight. They're most interested in the health of the community, and that's where we're at.
Dr. Jim Blaine, my guest today and around the Ozark Spotlight. Uh, you mentioned that you're about 75 years of age. Do you consider yourself more of an old family country doctor, or are you, well, are you connected to, or are you in favor of the digital age of medicine? Because I've known a number of physicians over the years, and
Mhm.
there seems to be a tug and pull
Yeah.
on that whole thing of, either sitting with a patient and having a discussion, or carrying around an iPad and basically, pressing buttons and saying, well, this is what it tells me you should do, and that sort of thing. Where do you find yourself?
Oh, probably, as you say, probably in the old part, but but no, I have electronic record, and was one of the first adopters of that, and I'm a firm believer in doing all we can to take advantage of that. However, a telltale sign for me was with each on-site clinic, DePaul Mueller's, this is utilities, OTC, DNP,
Hmm.
and since I had control of the number of minutes that I got to spend with each patient, it progressively got longer with each one. And what would happen, of course, like at the last one, I would leave 45 minutes per visit,
Hmm.
but even saying that, there's someone comes in with a sore throat or a sprained ankle, I don't need to talk to them for 45 minutes, and they don't want to talk to me. So obviously, but there are times if you need to spend more time, you've got it, and
Sure.
that is so good. It's I know this is kind of trite, but the medical school deans used to say that if you'll sit and listen to your patient long enough, they'll tell you what's wrong with them.
Hmm.
They may not know what's wrong with them, but you'll figure it out, And so uh, there was we had an AMA president, Tom Reardon. We had several AMA presidents that have come to town, and we've always volunteered our home. They always preferred that over a hotel.
Hmm.
And I remember Tom saying he was a family practice, and he was saying that he and his partner. I I'll always remember this because he said he and his partner both used the same number of time per patients, but his partner always got uh, a bad rap for seeming to be in a hurry. And the difference is that Tom would always go in and sit down and look the patient in the eye, and his partner would always go in and always have his hand on the doorknob and standing while he was, perception's everything. But hopefully, uh, I let that perception. I certainly learned that from him, and so I think that emergency room. I spent uh, total of 17 years in emergency trauma, and
Hmm.
most of that level one trauma, and very exciting, and wouldn't trade those experiences for anything. But however, I will say that it's the relationships that you develop, and so as I go around town now and bump into patients that I've seen that I bump into the ones that I saw in the emergency room too, but that was just once, or
Yeah,
twice.
sure.
But the ones that were my patients, that's a good feeling.
We're going to find out more about Dr. Jim Blaine's future and what his future plans are. We'll be back in a moment with more on Around the Ozark Spotlight. I'm your host, Scott Meier. Be back in just a minute.
Hey, everybody, it's Ethan and Sarah Forhetz from your favorite podcast, Around the Ozarks in 5. I'm sure you've been wondering, how can I get even more amazing stories, events, and witty banter to start my day?
Well, look no further. Here we are. Sign up for our daily newsletter. You'll have what's going on around the Ozarks right at your fingertips each weekday morning.
Yeah, just go to aroundtheozarks.com, click on the newsletter tab to sign up.
Thanks for listening to Around the Ozarks in 5. We hope to see you in your inbox soon.
Welcome back to today's part 2 of Around the Ozarks Spotlight. I'm your host, Scott Meier, and with me is Dr. Jim Blaine. Dr. Blaine is many, many years. That's good and bad, right? When people say many, many years, but you've been practicing medicine in and around the Springfield area for, 55 years?
Well, since 77, yeah.
Sure. So in its 50s of years of medicine, and you've seen a lot of changes come and go. We just got through a pandemic, and you, like everybody else, had to operate, literally had to operate in and around the pandemic.
Right.
What was that like for a medical person? Because, all businesses are different, and businesses had to work around it and work through it and work with their, employees and things. But as a medical doctor, you were faced with having to work directly with people who may or may not have been inundated with the virus. What was that like for you personally?
Well, pretty frustrating, really. Something happened during that pandemic. Of course, very few of us are still alive that remember the last pandemic back in 1913. But the
which you don't remember.
Well, I don't
you
remember
remember it, but you weren't running around Springfield in 1913.
No. So this was novel for all of us, and we were learning as we went. And
sure.
My nephew, who's a scientist, was fond of saying, because we change our mind doesn't mean we lied to you. This means we learned something.
Mm-hmm.
And so, but as you're well aware, it became politicized, and people weren't getting their vaccinations and so on, and weren't wearing masks and doing the things that the scientists told us that we should be doing. And so, Color 10 did a survey, and they paid for it, a big one. And it said, and they asked the question, who do you trust as far as your COVID information? And 84% said my physician. So we thought, well, let's see if we can impact that somewhat. So the Community Foundation gave us a little grant, and we got on Color 10, and we did a little PSAs, 15-second things, several of us, and we basically just said, I take my COVID vaccination. My wife and children, my grandchildren, are also taking the COVID vaccination, and we think you should too. And basically left it at that. Well, that was good because because here we are. I mean, we're the ones that they trust with delivering their babies and taking care of their heart attacks and car wrecks and all the rest. Stands to reason. This is our expertise. This is what we went to school and did all of our training to do, and we have the credibility, hopefully, and the trust of our patients. And so it did seem to make an impact. So then the next 2 months, so February, March, the health department stepped up and gave us more of a grant to go on KY3 too. And so we did that, and that was good. Most recently, as you're aware, and we kind of goofed up on this one because we were busy with COVID, but recreational marijuana was passed in our state, and it's about 3%. And I think that if more had been known about it, if we would have gotten the word out, what's happened in other states that did that, like Colorado and Washington, that it wouldn't have passed. But we were caught a little bit behind the 8 ball there, and it passed. But then the city council attempted to pass a marijuana tax. So we dusted off our PSA stuff and got on TV again. And a little tougher to get grants for this because this was a city council thing and kind of a little bit political, So
sure.
But it passed, and where KY3 has their coverage of 10 different communities. It passed by an average of 70%. So I don't know how much impact we had with that, but some. And so, and the whole idea is to get the word out on that. And so it's not what it was, the current marijuana situation. So
Mhm.
Uh,
Now, you were very involved prior to all of the pandemic and even the marijuana voting in DWI work.
yeah.
Tell us about that a little bit. Why the passion there?
Oh, well, I had, if there's any of my DWI task force members listening to this, they
Mhm.
may be a little bit surprised, but uh, I didn't want to put this on my coat sleeve because but my passion, you ask, is my little sister, when she was 19, was killed by a drunk driver
No,
and
I'm
her
sorry.
baby.
Mhm.
Yeah, and that's 1970, and was a huge impact on me, of course. And so finally, I and some others decided to put together a DWI task force, includes the sheriff and the police chief and the prosecutor, and some trauma surgeons and some other community leaders, and very importantly, some legislators,
Mhm.
Annie Bentley and Morris Westfall and Craig Hosmer, big time, uh, helped pass legislation that lowered the alcohol level to 0.08 legal limit.
Mhm.
Minors in possession. There's really quite a bit that got passed through that, and so it's. But right now we're faced with drugs more than anything,
I was going to
and
say, Jim, are we seeing there's impairment with the use of marijuana as well? Yes.
yes, yes. Interestingly, and actually, we are looking right now. Astoundingly, there is not very much research on this. We
Mhm.
know it impairs because Colorado. We were out there last summer and learned that in the past 10 years since they legalized recreational marijuana, their fatality rate involving marijuana on the streets it went up 138%. So
Wow.
we want to try to get ahead of that bubble.
Mhm.
And so, but unfortunately, there is no such thing as a marijuana blood test that will define impairment because THC, the psychoactive component of marijuana,
Mhm.
is lipid soluble, fat soluble. So it lands in the brain.
Mhm.
Alcohol is water soluble, so you can be very specific about that, of course, with that. But there's no breathalyzer for marijuana. There is no blood level that can define impairment. There is something that's possible, and this is what the DRE, the drug recognition experts in the police department, do and are trained to do, and that is apparently, if you're stoned, you can't cross your eyes. It's called
Is that
lack.
right?
Yeah, isn't that crazy? It's called lack of convergence, or LOC, and and there's another one that's pupillary rebound. Well, there's a little. I'll have to show this to you
Mhm.
since we live pretty close to each other. The but it's a headset, looks like a virtual reality, and
Sure.
it can actually uh, give objective evidence, not just subjective from a police officer, but objective evidence of the lack
Mhm.
of convergence. And so that does occur naturally in some people, 3 to 8%, but you can get around that by doing a little swab test.
Sure.
So you can test for presence of the exposure to marijuana.
Eh,
And so that may help us, uh, enforce that. But it is tough. This is not the same marijuana of
Back in the day.
long back in the day,
Yeah.
4% THC. Now it's 25, 30%
Wow.
THC in the smoke version, up to 80 or 90% in the concentrated version that they vape, and that they do what's called dabbing,
Mhm.
and that they also put in the edibles and compound that with, on the edibles. Sometimes they lace that with uh, the various drugs that can cause a lot of damage. So
Absolutely. Well,
it's trouble.
only in my mind would it bring. I'm seeing Marty Feldman taking that test, and I just don't know that he
Yeah, there you go.
he might he might fail. He might fail and still be under the influence. I'm not
Yeah.
sure.
Young Frankenstein. Yes.
Right. I'm sorry, but I just you caught
No,
me
no,
off guard with that one. I
you
don't think
know,
any of our listeners knew
that's
anything
it.
about that one. So,
Well, that's a great idea. That yeah, that may be some good PSAs there, right?
oh my God. Well, that's I thank you for sharing that. So we
Yeah,
talked before the break. We were saying, you've done all of these things leading up to this stage of your life. What's next? You said you liked running clinics because you were able to do it basically on your own. You didn't have people
right.
telling you what to do. But I've met Mrs. Blaine, and it seems to me that doesn't she work side by side with you, or didn't she in the clinics? And if
She did.
so,
Yeah, yeah.
I'm thinking she probably told you many times what direction to go in, unless I'm mistaken.
Well, she's a heavy influencer for as you know, but for such a lightweight girl. But no, she has been very supportive, fortunately for me, on
Mhm.
everything, and she gives me a wide berth. And so right now, I'm involved in the medical society, have been for many years. But my friend Jim Rogers, who was the head of the primary care for all of Mercy for many years,
Mhm.
we finally persuaded him to become president, and he's going to be president for 2 years. And so we're trying to increase the footprint of the medical society, and we're sending our journals out to all 1,500 physicians. We have strong support from both hospital systems and from their
Mhm.
leadership, and uh, and their leadership is coming into our leadership as well. So we're all working together for a common goal, and that's to improve the health of the community. So
How
that's
are we
that's
doing?
exciting.
Speaking of the community, how are we doing as a community in medicine? Do we have enough doctors?
Never. No. Right now, it's particularly primary care doctors.
Mhm.
We desperately need more. We do have a great family practice residency that's put out lots of really good family practice doctors here. Started by Dr. Larry Halverson, who I'm proud was one of my classmates at OU,
Okay.
and we're good friends. But he started that, and that continues. And they're getting ready to start a psychiatry residency over at Burrell, and we're looking forward to that too. But it's attracting doctors here isn't really tough too much because
Mhm.
if doctors go to their training in their final training, which is in the residency, they tend to stay around where that completes, right? And
Mhm.
so that's we found that to be true, and so that'll be helpful, and we're also hoping, again, through the medical society that we can get other doctors involved in community medicine with the Child Advocacy Center and with other, uh, nonprofit areas
Mhm.
that increase good health. And so, we're fortunate too. I mean, uh, this town, we all know each other, don't we? I mean,
Mhm.
it's if you're Kansas City, it'd be tough to get to know everybody. But in Springfield, we know our council, we know our mayor, we know uh, the Bob Dixon and the city council, or I'm sorry,
Mhm.
the county commission, and so and and the leaders in the community that you know giants like Charlie O'Reilly and his family, and uh, Johnny Morris, and there's just lots of support. The community
Mhm.
foundation is huge, and community partnership of the Ozarks is a collaboration of people that try to do good things for the community. So we're fortunate in that regard.
In the minute we have left, is there a mission statement that you have that's associated with the medical society here?
Years ago, it used to be uh, advocacy for physicians, patients, and the community. Now it's simply advocacy for good health in the community, and that's it.
Mhm.
And so,
Okay.
so I think that's the mission statement that we have now, and it's a really good one that I think we would be proud of.
Well, that's excellent. I want to wish you and your family a happy holidays. This is being the conversation during the holiday season, and hopefully everyone comes out the other end in pretty good shape. Anything you want to add?
Well, I wish you a happy holidays too. I hear that you may be going somewhere warmer.
Well, we've been spoiled here, quite frankly, in the Ozarks with some pretty nice weather. But yeah, I think we're headed down to Florida for a little bit. So yeah, hopefully the weather will be good there. But I appreciate that.
Safe travels.
What a great look back, Jim. Congratulations to you and all that you've done and all that you're still going to do. So thanks for spending time with us. I want to thank my guest today, Dr. Jim Blaine on Around the Ozark Spotlight. Also my producers, Taylor Worley and Jay Stevens, and all of you for joining us. If you happen to miss all or part of today's conversation, you can always find ATO Spotlight at aroundtheozarks.com or at the ATO app found in either the Apple App Store or Android app. There you'll find today's program as well as all of this past year's shows. I'm Scott Meier, your host, and remember, every day is a gift. It's the best present you can ever receive. Have a great day.